Hello and welcome to Health Digest, the health program that brings you news, analysis, and development on issues that affect your well-being. I'm Ogom Ezedimbo. And over time on this program, we extensively discuss antimicrobial resistance because it is a growing global threat that requires urgent attention. Amplifying awareness is crucial in curbing the dangers ahead. I'll quickly give you a rundown of statistics. According to what we have, Nigeria ranks 19th highest in AMR-related mortality out of 204 countries. And you will agree with me that this is alarming. And we also have 263,400 deaths in Nigeria associated with AMR. We have 64,500 deaths directly attributed to AMR as well. Beyond the health crisis, AMR has severe economic implications. The world loses an estimated 100 trillion naira to AMR. There is also a projected 3.8% reduction in GDP due to AMR. And the livestock sector also suffers a 3.8% decline, impacting food security and also agriculture. For clarification, antimicrobials are medicines used to prevent and treat infections in humans, animals, and plants. And these medicines are classified into four main categories. We have the antibiotics, we have the antivirals, the antifungal, and also the antiparasites. And today, joining us to shed more light on this topic is Dr. Sati Nguluku. I hope I got that correctly, first of all. The Director of Bacteriology, Parasitology, and Virology, only him, at the National Veterinary Research Institute, VOM, is also the head of Animal Health, AMR National Reference Laboratory, and also a member of the National AMR Technical Working Group. As we know, AMR follows a One Health approach, which means it involves humans, animals, and also the environment. So today we are focusing on animal health and the environment, two critical sectors in AMR prevention and control. Now, Doctor, before we begin, let me welcome you first of all. Welcome to the program.
Thank you very much.
Now, before we begin, I received an email. Like I said earlier, AMR is something we have discussed constantly on the program because we try to create awareness so people will understand what AMR is about. But I got an email and the lady said, that she's relieved. Why is she relieved? First of all, she said AMR is not a disease. You know, I say, yes, AMR is not a disease, okay? And then she went further to say that she's lucky, okay? That she's lucky that she doesn't take drugs, so she's not affected. She doesn't take medicines, and she's not affected. And besides, whenever she's ill, she tests and she treats, and she ensures that she takes doses complete. And I told her, I sent her a message, I said, watch out for our next episode because we are going to make you understand why you are not so lucky. So I think we should begin from there.
Okay. So thank you very much. Viewers, antimicrobial resistance is a topical issue. It's a global problem. And like you said, the person that sent you the email said she's lucky because she doesn't take antibiotics, and so she is free. So that's fine, but we are talking about these pathogens, these bacteria, that when they develop this resistance, okay, when they develop the resistance and the person that sent you this email, if unfortunately she is infected with that strain of bacteria that is resistant, especially those that are multi-resistant, it doesn't matter whether you are used to taking antibiotics or not. The issue is that the strain of the bacteria that if it gets infected, whether it's humans or animals, has a very serious implication. The implication is that the medicine that she used to take whenever she has any infection and it goes, it will no longer act on that particular strain of bacteria that is resistant. And that is the danger of antimicrobial resistance. So it is not about me as an individual taking care of myself and not, taking antibiotics, indiscriminately. The danger is those other persons that are not observing, what they are supposed to observe in terms of responsible use of the antimicrobials, can, drive those pathogens to develop those resistance. And once there is a resistance strain, it affects everybody or anybody that is, that particular pathogen infects.
No, we recently had a kind of a training on AMR where the Fleming Fund Ground Phase 2 was more like an eye-opener. Okay, we do understand that AMR is not just about human health. Yeah. Animals are involved. And people keep asking, how do animals contribute to all of this? How do the environment contribute to all of this?
Okay, thank you very much. Remember, we are talking about these bacteria, viruses, parasites. We have what we call zoonotic diseases. Okay, so these bacteria, there are some that affects both humans and animals. For example, salmonella, which causes typhoid fever in humans. Okay, and there are other strains that causes, diarrhea and other infections in humans. Now, these salmonella are also found in animals. They cause diseases in animals, so they can also cause disease in humans. So why animals are also very critical is that animals can also come down, remember, with diseases, and it can kill them. So the effect of this resistance strain is that when they affect animals, the animal, animals when they are sick, they are also treated. So if a resistance strain infects an animal, it means even when that animal is treated, that animal will not be healed. And the animal may likely die. Same with humans. And because these strains can affect both animals and humans. So if you have a resistance strain in animals, because humans and animals share the same environment, remember, we keep animals, we interact with animals. Okay, there are farmers, those people that take care of the animals, there is interaction. Also, when these pathogens are in the animals, remember, we eat animal products. For example, meat, milk, and the rest. So if they are infected, or the meat could be contaminated, once it's contaminated, it still gets to humans. Okay, and then when it can also get into the environment through water, okay, and so humans can also be infected, animals can be infected, and so when you have a resistance strain in animals, it can get to humans, and because it's a resistance strain, it means that the drugs that is you normally use to treat humans against that infection will no longer be effective, and that is the danger.
Now, the animal in question, for example, I have a cow, and the cow has a resistant strain, and then, which I didn't know, and then I kill this cow, and I boil, and I cook my soup, and I eat my food. Will I still have that strain? Will I contract it?
Yeah, so when you cook, yes,
won't the heat?
The heat will kill it, but during the process of cooking, remember, you buy this meat that is infected, you bring it to your kitchen, okay? Before you cook it, you use your hands probably, to hold it to cut. And if by chance maybe you use that your hand and then touch your mouth or your eyes or anything, if that pathogen is there, you are likely to infect it.
And so once I touch it and maybe I touch my mouth, is it coming straight immediately or?
Well, it depends on the pathogen. Okay, there are some, like I said, that some may not be through the air. If you touch it and then the pathogen is there, and then you use your hand to touch your mouth, or I remember sometimes maybe you are cooking, maybe you are slashing it, you are also doing some other things. You will know unconsciously. You may use that hand to put in your mouth or your eyes, or you may have a cut, and then that bacteria may enter, may get you infected. So you can get it through that. If it is well cooked, it can kill the pathogen. But during the process of cooking, anything can happen. So you can get infected.
Well, we know that antimicrobial resistance is the misuse and abuse of medicines. Okay, yeah. These animals in question, do they also misuse drugs?
So it is not the animals that misuse drugs.
The farmers.
It is those that keep these
animals. Okay.
Okay, whether they are pets, like our pets in the house, like dogs, cats, people keep these animals. It is the people that keep them that abuse the use of these drugs in animals. For example, farmers, poultry farmers, for example, a lot of them don't even consult veterinary doctors. In fact, a lot of them they know all the drugs that are available. And most times they don't even consult. Once they see the animal sick, they just go to a drugstore and then buy the drug. They know the prescription, they know the dosages and everything, which most times are not correct. And so when they apply these medicines or these antibiotics in particular to these animals, it may be underdose, it may be overdose. Okay, it may not be used. For example, the first thing should have been to first identify what is causing, if there's a problem with the animals. Okay, but most times, again, farmers just give antibiotics. They call it for prevention. Okay, especially the culprits are mainly poultry farmers, and then aquaculture, fish farmers. They will just buy antibiotics and just begin to give them. Even when they are not sick, even when the animals are not sick.
Does it contribute to their growth?
So that is the abuse for the animals. So it's not the animals that abuse the drugs. It is the humans that keep these animals that underuse or overuse these drugs on the animals.
So do they actually give fishes antibiotics?
Yeah, they do. They do. Remember, there are also animals, they get sick and they are treated. Okay? So, but they should be, handled by professionals. But what happens, I remember the administration is mainly through water. So most times, in fact, I was told that somebody visited a fish farm, and when he went there, what he saw was amazing. A lot of sachets of antimicrobials were littered around the fish farm. And that tells you the quantity and the volume of antimicrobials that is used in the fish sector. Same in the poultry sector. Similarly, too, in the livestock sector. And most of these antimicrobials are not even prescribed by professionals, qualified professionals. Farmers just go to the market and just buy these drugs. And that also leads us to, the availability of these drugs in the open market. Ideally, antimicrobials is a prescription drug. Antimicrobials should not just be sold to anybody unless it is under prescription, unless it's prescribed by a doctor. But in our climate, that is not the practice.
NAFDAC has a lot of work to do, and also the health ministry. But how does antimicrobial misuse in agriculture and in human health contribute to the environment?
So there is interaction between humans, between animals, and the environment. We all share the same environment. So there's interaction, constant interaction. So, for example, in the farm, okay, when antimicrobials are administered to animals, and because of the misuse and other drivers, and then which developed or lead these pathogens to develop resistance. And because, like I said, some of these pathogens affects both humans and animals. And they can be shared into the environment, either through feces, through urine, manure, and the rest. So it gets into the water, it gets into, the sewage system, into the drinking water, into the environment. So it pollutes the environment. And humans and animals that interact with this environment can be get infected. So that is why these three help. And because of misuse of these antimicrobials in humans or animals, so once these pathogens develop resistance, they can be shared into the environment and then can be shared between humans and animals.
Does it affect plants?
Yes, including plants. Plants too, even though it's not very common in our part of the country, but it is also becoming a problem because, remember, plants too have diseases. Okay, the bacteria, viruses, fungi affects plants, and they are usually treated. So if they are treated, they are also treated with antimicrobials.
Antimicrobials as
well.
So
those ones can also develop resistance.
Sometimes, when you hear these medical issues, sometimes they make you laugh because you try to, process everything in your head and all of that. But let's see the economic impact of all of this. I actually earlier said that globally $100 trillion.
Yeah, so it is estimated that if, we don't take action against this silent, killer and pandemic, it's not only, the effect on public health, but also in the economy. And it is estimated that if actions are not taken by 2050, it will cost, in terms of in economic terms, it will cost about $100 trillion in terms of economic loss to the whole nations. So it is an economic disease too, because you can imagine if people are infected with a resistant strain of bacteria, people will be hospitalized, so they won't go to work, okay? And then the costs of treatment, because when when the infection is resistant, you can imagine they have to be trying all sorts of drugs, and that costs. So there's increased costs in terms of medication. And also, if you look at the livestock sector, there's a huge economic loss because there will be decrease in production, and that will lead to food insecurity. So there's a lot of economic loss as a result of antimicrobial resistance.
So what steps should farmers take, veterinarians and policymakers, to see how we can reduce this resistance that is gradually becoming a threat?
So there's a lot that we need to do, but at the policy level, okay, policies have to be, we have to come out with very clear policies that will help in addressing this issue of antimicrobial resistance. And this will be in the form of, regulations, guidelines. We have guidelines, we have rules and regulations. We have legislations, that are put out there so that it will reduce the impact of this antimicrobial resistance. But I think part of our problem is enforcement of these legislations. For example, there are laws that antimicrobials should not be sold on the counter. But most times those are, they are not enforced, and those are the issues that we need to to really step up and strengthen. The regulatory bodies have to up their games to ensure that, people comply with these regulations, because it is for everybody's good that we comply.
Now, Doctor, before I'll let you go, there's something that I really want us to talk about. Many people believe that antibiotics, because antibiotics is actually the main that people actually abuse. You have headache, you go and take antibiotics. You have cold, you go and take antibiotics. But I need you to clarify that antibiotics shouldn't be used to treat viral infections.
Well, like you said, we have antivirals, we have antibacterial. So antibiotics are antibacterials. So they shouldn't be used to treat viral infections. But sometimes they are used to, to take care. When you have viral infections, there are what we call secondary infections, which are caused by bacteria. So sometimes it is prescribed to take care of the secondary infections, which are the bacterial infections. But like we said, it should not just be taken, okay? There has to be an evaluation. There has to be a test, okay, diagnostic test, and then, clinical evaluation that has been done by a qualified personnel that shows the indication that antimicrobials should be administered and it should be prescribed. So it's not that because you are having cold, you're having a cough, and then you just go and buy antimicrobials and use. Same for, livestock keepers. Once they see their, for example, poultry farmers, when they see that their production is getting down, the first thing is to pump antibiotics. In fact, some of them from day one, as they are bringing those chicks, they place them on antimicrobials until, if it's broilers, until they go to the market. And that should not be. One critical thing, especially in, including human, is what? Prevention. Sure. And what are those preventive measures? Just hygiene, pure, simple hygiene. Okay? For farmers, strict biosecurity in the farms. Once we institute that, we will cut down the use of antimicrobial drastically. So infection prevention and control is very key. There are also vaccines that are available.
For these animals?
For animals and humans. Okay? So once there is increased uptake of vaccines, the vaccine is meant to prevent infection. So once there is no infection, there will be no need for antibiotics or antimicrobials. So I think our advice and the advocacy is for people to institute preventive measures. Once those preventive measures are in place, it will reduce drastically the use of antimicrobials. And again, we should not just take antimicrobials because we want to prevent. It should be based on, expert opinion.
All right, thank you so much. We have been speaking with Dr. Sati Nguluku. He is a director at the National Veterinary Research Institute in VOM, and is also the head of the Animal Health AMRO National Reference Lab, and also a member of the National AMRO Technical Working Group. Thank you so much for your contributions.
Thank you very much. Thank you, and thank you for the good work you are doing. Keep on advocating, keep on creating the awareness. That is what we will continue to push, so that people get aware, and then they will continue to do the right thing.
All right.
Thank you very much.
Thank you, Doctor. The program has been Health Digest. Like the doctor said, do not self-medicate. If you're ill, you have to go for a proper evaluation. And also note that antimicrobials are not over-the-counter medications. They are prescription drugs. So if you must take any antimicrobials, ensure that those drugs are prescribed, and prescribed by a medical doctor. And that's it on the program today. Thank you so much for being a part. I'm Ogom Ezedimbo. Stay safe.